Hello and welcome to this presentation from us, the General Medical Council, on supporting interim FY1 doctors during the COVID-19 pandemic. My name is Dan Wynne and I am part of our outreach team, which works with doctors and medical students across the UK, helping you to understand how our ethical guidance applies to your practice. During this presentation, we aim to highlight our advice and ethical guidance to assist you during the COVID-19 pandemic. We'll also tell you where you can find this advice and guidance, as well as other sources of support on our website. But first of all, a big thank you from everyone at the GMC for putting yourself forward to take up an interim FY1 post at this time of need. We're here to offer you support, advice and guidance during this difficult time. The first resource on our website that we'd like to highlight is our coronavirus information and advice section. A web search for GMC coronavirus information and advice should help you find the page easily. This area of the website has information for different groups, including trainees and medical students. It also contains information on this year's provisional registration process. Within the provisional registration page, you will find a link to the full guide to provisional registration during the coronavirus pandemic. This is aimed at all people graduating this year and includes information specifically for you as an interim FY1 doctor. While the content about applying for provisional registration is no longer relevant for you, the guide contains advice about interim FY1 posts, practicing in challenging circumstances, and your well-being and support. In the following few slides, we'll highlight some of the guidance, but we'd strongly encourage you to read the full guide. In the Your Options section of the guide, we make clear that you must be supported by good induction, training, and very importantly, supervision. We and the UK Foundation Programme Office have agreed clear parameters to the type of work you are able to complete. Possible tasks include note-taking, ordering investigations, venesection, intravenous cannulation, supervised prescribing once you've passed the prescribing safety assessment, and completion of discharge documentation. You should only see acutely unwell patients under direct supervision, and it's recommended that you are buddied with doctors in Foundation Year 1 or 2. In the Practising in Challenging Circumstances section of the guide, we make it clear that you should only perform the tasks that are within your competency and job description. If you're asked to perform at the limits of your competence for your stage of training, you should be supervised by an appropriately qualified senior doctor. If at any time you think patient safety, dignity, or comfort is being compromised in ways that are avoidable, you should tell a senior colleague or manager. You should work with colleagues to find a solution and always keep a record of how you handled your safety concerns. We are aware that practicing in challenging circumstances may be difficult. We'd like to reassure you that in the circumstance that a concern is raised about a doctor, it will always be considered on the specific facts of the case. We will take into account the situation in which the doctor was working and any protocols in place at the time. During times of pressure, it's important to remember to look after your own health and well-being. The Wellbeing and Support section of our guide on provisional registration starts with a short video. In it, our chair, Dame Claire Marks, welcomes you as new doctors to the profession with some key messages, including the need to look after yourself and colleagues. We'd highly recommend that you watch it. The next area of our website that we'd like to draw your attention to is our coronavirus FAQs. A search for GMC coronavirus FAQs should take you to the section. The FAQs are aimed at all doctors, but will be of use to you as an interim FY1 doctor, even if some of the advice is predominantly aimed at more senior doctors. We will be reviewing and adding to this section, and at the time of recording, the section contains questions and answers on your health and well-being, working safely, remote consultations, decision-making and consent, confidentiality and social media, leadership, and end-of-life care. The FAQ pages on your health and well-being and working safely go into some of the issues covered in the provisional registration guide, but in more detail. Here are examples of some of the answers you can find. Our FAQs on health and well-being address questions such as, what can I do if I feel overwhelmed? Here we acknowledge that we are in unprecedented times, and it is okay not to feel okay. We also provide information about helplines you can access and links to other useful resources. In our answer to how can I help my colleagues, we suggest you regularly check in with your team. You could also set up a buddy system where you pair with a Foundation Year 1 or 2 doctor. And for how can I prepare myself for practice, we recommend that among other things, you read our advice and guidance. While this issue may be less likely to affect you as an interim FY1 doctor, it is still important that you're aware of our guidance. If doctors think their PPE is inadequate, we make it clear that we do not expect doctors to provide care without regard to the risks to themselves or others. We outline principles that doctors will need to consider in the circumstances. These include whether treatment can be delayed or provided by another team, and what course of action is likely to result in the least harm in the circumstances. We also answer, is it okay to refuse to treat a patient if a doctor doesn't have the right PPE? While we'd expect doctors to work with colleagues to provide the best care possible in the circumstances, if you believe that it is not possible to treat patients without unreasonable risk to you and other healthcare professionals, you should escalate your concerns. You should also record your decision, including how you tried to address safety concerns. Another question we answer is, will doctors face action if they refuse to treat patients? If a concern was raised with us about a doctor refusing to treat a patient because of concerns about inadequate PPE, we would need to look at the specifics and manner of that refusal, as we would with any other concern referred to us. We would take into account the environment in which the professional is working, as well as information about resource, guidelines, or protocols in place at the time. In the working safely section of the FAQs, we also address the question of what if I'm asked to work outside my competence. Here we say you should seek out advice, clinical supervision, and training. In an emergency, you should provide the safest care you can. And if you think that patients are being exposed to avoidable risk, you should tell a senior colleague or manager and work with colleagues to find the best possible solution in the circumstances. Make sure to record any concerns about working outside of your competence, how this could impact on patient safety, and the action you've taken to address it. We also answer the question, can I advise family and friends if they think they have COVID-19? It's fine to explain and reinforce public health messages, but wherever possible, you should avoid giving medical care to yourself or anyone with whom you have a close personal relationship. The following 3 slides contain examples of questions and advice in the FAQs regarding consent, confidentiality, and end-of-life care. Our FAQs on decision-making and consent relate to circumstances in which doctors may need to make difficult decisions about access to care. Our answers reiterate that decisions about access to care must be based only on clinical need and effectiveness of treatment. Difficult decisions should be taken following discussion with patients, colleagues, and if possible, local ethics committees. We remind doctors to be open and honest with patients and the rest of the healthcare team about the decision-making process and the criteria for setting priorities in individual cases. It's also important to keep a record of decisions and the reasons for them. Our FAQs on confidentiality deal with circumstances in which patient information can be shared without consent during the pandemic. For example, where action must be taken quickly to detect or control outbreaks of a communicable disease. We emphasize the need to establish with the patient what information they want you to share, with whom, and in what circumstances. And we offer some very important advice on social media and maintaining patient confidentiality, which we'd recommend that you read. Our section on end-of-life care addresses questions linked to advance or anticipatory care planning, such as when should doctors discuss ACP with patients and carers? What should doctors consider and discuss with patients, carers, and others while drawing up or reviewing an ACP? And what if a patient already has an ACP? The answers to our FAQs draw on our full guidance, which continues to apply as far as is practical in the current circumstances. All of our guidance can be found on our website, and we'd urge you to refresh your knowledge of it. At several points during this presentation, we've touched on the issue of raising concerns. As well as our full guidance on this issue, we have a guide in the Ethical Hub section of our website entitled Speaking Up. The guide includes practical tools and advice on raising concerns, including how to speak up within your organization, organizations that can support you, and advice on raising concerns externally. Remember that all doctors have a duty to raise concerns where patient safety, dignity, or care is compromised. You should get to know your local processes for raising concerns and who to speak to. Raising concerns is extremely important, including at times of pressure. And remember that it is not about blame. Raising concerns enables action. If you ever need to speak to us, whether about an ethical question or another issue, search GMC Advisor, and you should find this page on our website. Here you will find a range of ways to contact us, including email, live chat, and the phone numbers of several of our teams. We're here to help. We hope you've found this presentation useful and that our advice helps you as you transition from medical student to doctor. Remember that at all times during your career, but particularly now, to be kind to your patients, be kind to your colleagues, and to be kind to yourself. Finally, thank you for listening. Thank you again for everything you're doing as an interim FY1 doctor. And remember, we're here to help.